Do you need to see a psychiatrist in order to get good mental health care? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and this has come up in some of my recent comments where people have talked about how they had a negative experience with getting their primary care doctor to prescribe medications, or a mid-level provider like a physician's assistant or a psychiatric nurse practitioner. Let's kind of talk about the different training journeys of each of these different practices. So for reference, a psychiatrist is going to go through 4 years of undergrad, then 4 years of medical school, then they are going to go to at least 4 to 5 years of post-medical school training, which we call residency. So a general adult psychiatry residency is going to be 4 years. If they choose to go on and do fellowship, that fellowship is going to be 1 to 2 years, depending on what that fellowship is. Now, a primary care doctor is also going to go to 4 years of undergrad, 4 years of medical school, and they're going to do most likely a 3-year residency in their field of choice. So this might be internal medicine, pediatrics, as well as family medicine. And during that 3 years, they're going to be focusing on basically all of the different systems in the body and all of the different medical problems that someone can have, which will include mental health concerns. But as you can imagine, this is a relatively smaller portion of their entire training. So they're going to have much less of the psychiatric training. Now, in contrast, mid-level providers are going to have significantly less education. And please forgive me if I'm wrong on any of this because I'm not a physician's assistant or a nurse practitioner, so I apologize in advance if I make any errors. So a physician's assistant is going to have 4 years of undergrad, and then they're going to get their master's as a PA, and that is going to be another 2 to 3 years depending on the program. Versus a nurse practitioner is going to do either 2 to 4 years of post-high school training to get their RN or their BSN. And then they can either get their master's as an NP or their doctorate. So the length of training here can really vary from about 1.5 years to 4 years. So as you can imagine, an NP who has an RN and then goes to a 1.5-year training program has much less experience than someone who has a BSN, did a lot of clinical experience, and then did a 4-year doctorate program. Both of these training programs are going to be pretty generalized. People are going to get exposure to everything just like a primary care doctor would, and then they are largely going to learn on the job after they complete their training. However, there are some residency programs or postgraduate training apprenticeship type things where people can get more extensive training in whatever they are interested in. There are also psychiatric NP programs for those who know they want to go into psychiatry, and those programs are more tailored towards mental health rather than as broad of the general overview. Okay, so all that being said, you can see that there is a lot of different levels of training and education in mental health amongst these different types of providers. And clearly the psychiatrist is going to have the most extensive training. So at the end of the day, a psychiatrist is going to be the most highly qualified to see you for your mental health care. That being said, are all psychiatrists better than primary care doctors or psych NPs or PAs? No, absolutely not. So I think a lot of it is going to depend on that individual. One, just their personality, the way that they establish rapport with the patient, but also what types of trainings they've pursued in addition to their baseline training, and what types of interests they have and how self-motivated they are to keep learning. Most of what I know is self-taught, so I don't necessarily think that some additional certification or program is necessary to become a really excellent provider. And the truth is that there are not enough psychiatrists to go around for everyone who needs mental health care. So it is necessary that some of this care falls onto primary care providers and some falls onto mid-level providers. So what I would say is that it's more about your interaction and relationship with that provider, about doing some research on what their areas of focus may be, and of course being willing to make a change if it's not a good fit or you don't feel like you're getting good care. Primary care doctors, because they're managing so much, that is usually reserved for people who have pretty simple mental health issues and or to kind of bridge someone until they're able to connect with a mental health provider. If you have any questions about this, feel free to put them in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.